Right, welcome everybody back. I just wanted to go over our last session quickly, what you remember about it. So we spoke about communication and using the cue cards. So has anyone thought about using something like that with what they already do or ever needed to? No? No, fair enough.
I haven't really found an area to use it.
That's okay. Fair enough. What do you remember most about the session last? Anyone?
I remember about the cue card the most and how it would have helped when I was looking after my mum.
Yeah, sure. Well, today we're going to do a bit of a PowerPoint display more about what dementia actually is, how it affects the brain, the different types of dementia, and just to get a greater understanding, because then we can understand how communication techniques work better. So with today and learning about dementia, I want to ask you all, have you ever forgotten something such as where you parked your car?
Oh yeah.
Yeah.
Yes?
Yeah, a lot of times.
On why you walked into a room?
Yes.
Yes.
Or why you went to the shops?
Mm.
Yes? Have you ever forgotten what colour your car is?
No.
No, that's another common thing with dementia. Some people have even forgotten that they have a car and catch a taxi home or walk home and leave their car in the car park, which is a bit of a...
That's a bit of a worry.
Yes.
Yeah, it
Wow.
is, yeah. And you think, well, maybe they probably shouldn't be driving in the first place.
I didn't understand that.
Well, fair enough. We'll go through your understanding and we'll get there.
Turn it off.
I'm trying to,
Oh,
but it
okay.
won't come. It won't open.
Okay.
That's okay. Yeah, so we're going to start our display. So we're going to go through what is dementia and communication challenges that come along with it. Okay. You want to work?
There we go.
There we go. Okay, so dementia is a term used to describe a collection of symptoms including memory loss, reasoning and communication skill decline, and loss of skills needed to carry out activities of daily living. It's generally progressive, so once you get your diagnosis, you're well aware of what's coming. And I think that's the scariest part of dementia, when you realise what's coming next and you know that eventually you're not going to be able to recognise your family. Yeah, it's a syndrome that can be caused by over 100 different disorders. So there's so many things that can cause dementia, including head trauma, head injury, stroke, and other illnesses such as heart disease and motor neuron disease, which is sad because that's a brutal enough disease as it is. Okay, symptoms of dementia. Loss of memory is the one we all know the most. When you're having a conversation with your loved one and they can't remember what you said 5 minutes ago, it can get quite frustrating. There are all the different types of dementia affect people in different ways, and every person who has dementia is different. How one behaves is not going to be the way someone else behaves. It's very different and a very unique experience for everyone who suffers from it. So yeah, we're going to go through. It's normal to forget, but sometimes it is important to look deeper. We mentioned at the start, forgetting where you parked your car. We've all done it. Everyone at one point is going to do that, but remembering whether your car is red, green or blue is something entirely different. And remembering what kind of car you drive, whether you drive a Ford, Holden, a Hyundai, whichever, is another thing that you could forget, and then you could be walking around wondering, you know, what colour your car is, what make your car is, and then you get frustrated within yourself because you don't know, you know, why can't I remember where I parked my car? Types of dementia. Now, there are lots of different types of dementia. I've picked 4. These ones are the main 4. You've got Alzheimer's, Lewy body, vascular and frontotemporal. So dementia itself is an umbrella term, which means that there are different types of dementia, but they all form into the same category. There's so many different causes of dementia, like we mentioned before. Why don't you want to work for me? So we're going to go through these ones one by one. We'll start with Alzheimer's. Okay, so the main characteristics of Alzheimer's, you've got becoming confused and frequently forgetting the names of people, places or important events. The mood swings. You can go from being unbelievably happy to very, very depressed in a matter of seconds. The landslide is just instantaneous so many times. It's caused by proteins that tangle around in the brain cells, causing them to misfire at each other, which is why you can't remember certain things and have difficulty putting sentences together. Even carrying out daily activities such as having a shower, remembering if you had a shower, did you take your tablets? Yeah. Right, we're going to look at vascular. Oh, no, we skipped vascular. Go back one. Thank you. So the vascular is more problem with speed of thinking, concentration and communication. This is where the aggression comes into it. Those with vascular dementia are the ones that mainly show the aggression. It's more of a behavioural, and that's actually caused by oxygen and nutrient supply to the brain is reduced because of narrowing or blockages of blood vessels. Stroke is a main cause of vascular dementia. They kind of tie into each other. So if you've had a stroke, unfortunately, you might end up with this type of dementia. Okay, it can appear very suddenly, so it's not such a slow onset, it's more of a sudden onset. And it can coincide with the stroke or development with a series of small strokes. Now, with small strokes, you don't even know you've had one. They could go unnoticed for years before they cause a problem such as vascular dementia. Oh dear, we'll go to the next one. Lewy body dementia. I believe, in my personal opinion, this one is probably the most nasty form of dementia. This one's more linked to Parkinson's disease. So you don't only have the symptoms of dementia, you have the symptoms of Parkinson's to go with it. So you get the shakes and you get the muscle. There we go. Okay. So, while we're on topics of dementia before we move on, did anyone realise there were different types of dementia? Or generalised?
I knew there were different types, and that's only because there was a lady who was in the next room to my mum in the home, and she had that really angry
Vascular?
Yes, yeah, or vascular. Yes, yeah. She was really cross because mum was in that room, because that was her mother's room.
Okay.
Yeah, so mum had a lot of difficulties with that lady, and that was very unusual for that lady to be like that.
Sure. One of the
So I knew they were types simply because of that.
Yeah, one of the hardest things with vascular dementia is it's more of a short-term memory loss. You can remember your childhood or what you did for a job. I remember one man would wander around a nursing home where I used to work, 7 p.m. every night, calling for his dog. And Coco, every night, same time, because he used to work on a farm. He was a sheep farmer. So every night around that time is when he'd call his sheepdog inside, and he'd get really frustrated that he couldn't find his dog, and would go around asking everyone if they stole his dog.
Wow.
Where's my dog? You've got my dog.
Mm.
And again with vascular dementia, and that's where sundowning comes into it too. Has anyone heard of sundowning?
No. Oh, when the
No?
sun goes
What?
down, you change?
Oh yeah,
Yes,
pretty much.
yes.
Yes.
Wow, okay.
Sundowning. It's more of a thing where at a certain time of an evening is where you would be cooking dinner or picking kids up or putting kids to bed.
Mhm.
These are all things you remember. So when it comes down around those times, you know there's something you're supposed to be doing at that particular time, but you can't remember what it is. So you're wandering around getting more and more frustrated, thinking there is something I'm supposed to be doing right now, I just don't know what it is. And that's where aggression comes in, frustration, even hallucinations, where you actually think that you've seen a parent who may have passed away, and you swear that your mum's there, that she's been there to visit you, don't understand why she's not coming back.
Yeah.
So hallucinations and vascular dementia kind of do go hand in hand. Sundowning, yeah, it's a bit of a, it's a hard thing to deal with too, to how to distract, to cause some kind of distraction to go to a different direction. With that man I mentioned, the best thing with him that worked was to take him to the pantry, to tell him you're going to look for dog treats. All right, let's go look for some dog treats to see if we can call your dog in, and on your way to the pantry you could be talking about sandwiches and then cups of tea,
Okay.
and then you change it
Distraction.
to like a distraction or a
Yeah.
new
Change the
direction.
thought process.
Change thought process, exactly, and that worked every time. So once you've figured out what works for someone as a distraction, always make sure you document it, so that other carers who come along to look after that particular person
Yeah.
can then, okay, this works, this distraction technique will work, I'm going to use that if need be.
Yeah.
Okay. Alright, how common is dementia? It's actually more common than you think. A lot more common than you think. 61% of people with dementia are women. So it affects women a lot more than it affects men. But 1 in 14 people over the age of 65 have a diagnosis of dementia.
Wow.
1 in 14. It's a very, very common, but because there are so many different types of dementia, the you don't have to have something like Alzheimer's or Lewy body dementia or vascular dementia, because you could have something that's a lesser form, not as brutal, but still have the forgetful factor or the memory loss or behaviour issues, just not as severe as one of the big four. Okay, various forms of dementia. So Alzheimer's is the most common.
Wow. 62%.
The least common is Parkinson's disease.
Okay.
Yeah, even the way that Parkinson's disease ties in with dementia, because Parkinson's disease is something entirely different, but because you get the shakes, you get the muscle degeneration, that also affects the brain and will shrink the brain, causing its own form of dementia. Go back to prevention, my friend. Alright, can it actually be prevented? That's something that scientists are still kind of working on. There's no 100% guarantee of anything that'll prevent dementia. You could be the healthiest person and live exactly how they all tell you to live and still get it. So it's one of those things that they're still doing research on, but they can say, you know, healthy living, exercise, reduce alcohol, have a good diet, don't smoke, and lose weight can all help, but there's no actual scientific evidence that backs that up.
Okay.
There was thought that doing a crossword every day would prevent
Crossword
it.
or
That's-
memory
that's
exercises.
apparently not.
Thank
Still
you.
singing, Maddie?
Oh, I think so.
Yeah,
Yep, there he
yeah.
is. There we go. Diagnosis. Blood tests can rule out any other physical reason for for the symptoms that you're having. But it is very important to get a proper assessment, which means you'll probably see a few different people of a team. You've got memory, thinking or behaviour, so an occupational therapist, speech therapist, and even scans of the brains like CT scans or MRI scans, just to see how your brain sort of responds to any kind of stimulus. Yeah, so diagnosis itself can take a long time. It can take weeks, months, sometimes years, depending on any other issues that you may have already had. Diabetes can make diagnosing dementia harder.
I know.
Oh, wow.
Only because your brain sort of presents the same sort of way.
Yeah.
So you'd need to have more tests, such as the speech therapists, the occupational therapists come in with their little paperwork and tests that they come in with.
Is dementia hereditary?
No. Well, there's no evidence to suggest that it is.
Okay.
Oh, it's all good. It's all good. All right, about me. It's important to remember that everyone is their own unique individual. Everyone has their own likes, their own dislikes, which is where it comes down to person-centered care that can provide insights into your own experiences with that particular person, to what works for them. That coming back to communication techniques, getting to know someone's past, whether they speak any languages other than English, can help with your own communication techniques. Just learning their personal experiences, their background, where they've come from. Talk about their care plans. We're going to go back to care plans because they really are important. Documentation's important, because if you didn't document it, it never happened. If you can't prove it, it doesn't exist. So anything that changes with the person you're caring for needs to be documented. Medications they've taken needs to be documented, because it's not documented, it never happened. Talking about a person's background in their life. We were talking about that man who owned the sheep farm. Our granddad owned a sheep farm. I have very fond memories of being on that farm and the go-karts and chasing the sheep. Probably shouldn't say that, but and no, if I was unlucky enough to get vascular dementia, they're things I would remember from my childhood, from being on the sheep farm. So you can tie in your own personal experiences when caring for someone who has dementia, because they might not remember it, but in some part they can relate to it. Alright, importance of communication. It's important to establish some kind of communication. Like we used the cue cards last week, that's one form. But you've got non-verbal communication, you could use sign language, you could use a whiteboard to type things up on if you needed, or write things up on if you needed to draw pictures, or they could draw pictures. Communication is something that we do every day, and it's probably one of the most important things that we do every day, because it's how we get across what we need, or what things that we want. Are we tired? Are we hungry? That's how we communicate. So if that was taken away from you and you're starving, you've got no way to communicate that need to someone, you're going to get aggressive. I know I would. So learning different forms of communication and how to communicate is extremely important. We need to demonstrate active listening skills, and I know that in itself is hard sometimes to, I mean, we all know how to listen, but active listening, you don't just hear, you see what their body's doing, their eyes. Are they sad? Are they happy? Are they excited? You can tell a lot just by looking at someone's eyes. common problems with communication, word finding difficulties. One aspect that All About Me can help with is alright, so looking at challenging behaviours that can come back to, again, how someone's lived their life, their religious beliefs. Those who are Christian can say that they celebrate Christmas and Easter. There are holidays you can incorporate into their care, but if you've got someone from a different religion who doesn't celebrate those things and you mention one of them, they can get quite offended and quite upset and taken back. You know, how dare you speak about such things with me? A lot of people incorporate religion into their care, especially end-of-life care. That's a topic for another time, I guess. End-of-life care is a bit more of a larger topic that some people can get a bit sensitive about, because especially myself, I'll talk for myself, I find it hard to talk about end-of-life care because it makes me kind of face my own mortality. I don't like that very much. So another reason for challenging behaviours could be dehydration. Maybe they're thirsty. Maybe they need to go to the toilet. Maybe they have an infection. I'm not sure if you remember from last week, I spoke about that lady with the abscess tooth who became really, really aggressive because of that infection, and that was her way to communicate, but no one picked up on it, and then ended up costing her her life. So fear. Maybe someone's afraid of where they are, especially when you've just moved in to your new facility. You're surrounded by strangers. There are strangers who want to shower you. I know how I'd feel about that, and that's not. I wouldn't be letting that happen, I don't think. Maybe, fear of your new environment, different noise, different lights, unfamiliar people. All these can cause different challenging behaviours. And it's important then to also read through care plans to find out what triggers certain behaviours, what makes this person angry or anxious. Go to that one. Alright, so what might a challenging behaviour look like? They are almost always present because of an unmet need. Almost always you will find someone's being aggressive because of an unmet need. So again, it could be maybe they're thirsty, maybe they're hungry, maybe they're frightened or scared. I'll give you another example of this lady who refused to come out of her bed. Every morning she'd refuse to get out of bed. You've got to look at this problem. Okay, why? She said, there's spiders everywhere. There are spiders everywhere. I'm surrounded by them. There were no spiders there, but in her mind, in her hallucination, they were real. They were there and they prevented her from getting out of bed. And the carer that I worked with walked in with a can of fly spray and just started spraying the room. But it worked. Yeah. Because then all of a sudden the spiders are dead because they've been sprayed. It's all right for me to get out of bed. So any kind of unmet need, we can always find out what that is using different communication techniques and help them have that need met. Whether it
playing their game with them.
Yeah, exactly.
Yeah.
Exactly.
You're virtually controlling an illusion with another illusion.
Exactly. But it works. And that's the thing a lot of people don't understand, that hallucination or an illusion might not be real to us, but it is very, very real to the person experiencing it. So you can't downplay that, oh, it's all in your head. The worst thing to say. The worst thing you could possibly say, because they will never trust you again. Why should I trust you when you don't believe me? Why should I speak to you when you're going to speak to me like that? I hated it when people would say that to me. It's all in your head, it's not real. Like, hang on 1 second. Yes, it is. It is real, and it's not all in my head, thank you very much. So you play along with it. Okay, what are you seeing? Where are you seeing these things? What would you like to do about it? And some of these hallucinations can be quite frightening when you hear your patient describing these to you. They are really, really deep and really frightening. So understanding how to pull them out of that particular hallucination without causing anger, it's a hard thing to do, and it's a skill that you develop over time. Can most certainly be done, but be very careful the way that you speak and the things that you say, because they're out of everything, they're the things they won't forget. Weird, I don't know why it's doing that. Okay, families, carers and friends. The majority of those who look after people with dementia are families and friends. Okay, and that's where it puts on carer burden. If you've ever had to look after a family member who is ill, you would know all about carer burden, and it is it's a burnout, effectively. That's where you need to look at things like respite. You need a break. You can always send your loved one to a respite facility, or even have in-home care. Someone come to your house to do all your cleaning and give you some time to go out shopping while they sit with your loved one. Yeah, it's important to look after yourself, and that's something that we all tend to forget. Even as carers working in facilities, you will hold your bladder even though you've needed to pee for over an hour, because there's still so much work to do. And when working in a facility, you've got a certain amount of patients that you're supposed to have up and ready by a certain amount of time. It's an impossible goal by yourself. Some of the things they set for you are, it's just not possible, and it's cruel, because you can't get someone up, showered and dressed in 10 minutes. It's just not going to happen, especially someone who has brittle bones, who has difficulty moving and can't transfer themselves and can't shower themselves. Just can't do it in 10 minutes. And there's a lot of things wrong with the aged care system that we do need to work out and change, and most of that does have to do with staffing. There was a facility I worked at, I did a night shift, and we had 48 residents in the establishment with 2 carers and 1 registered nurse. It's impossible, absolutely impossible. And when you think, especially when it comes to medications, and you've got the DDAs, such as endone, morphine and fentanyl, it has to be 2 nurses who sign for that and give it, because you need to sign it out the cupboard, so when they do the medication count, they can account for it, so it's not missing. You can't do that with a nurse and a carer. So if one of these patients, say they needed endone overnight, couldn't have it, because I couldn't sign for it and I wasn't prepared to. And that's something else as carers, you've got to remember, do not give medications that you have not prepared yourself. It'll happen, you'll have a nurse come up to you, can you please give this to such and such? No, don't do it. Do not do it. If they want you to do it, you prepare it. So you know exactly what you're given, and you can sign for it with confidence, that so your signature's next to that. Yes, this is what you've given at this time.
So for like correct doses and correct medication.
Absolutely correct time, correct patient. That's exactly right. Never, ever, ever give a medication that you have not prepared yourself. All right, that's the end of the slideshow. Got any questions?
Wow.
No, it's just brought up a lot of memories.
Yes.
You know, as in getting carers to come and help you, and that was one of my problems towards the end, where I wasn't coping.
Yeah, sure.
And trying to get, you know, speaking to the right people, which I finally got, and they said they were organised carers, and it just didn't happen. And by the time Mum was in a home, they rang me about 3 months later and said, "Oh, we can organise that caring for you now." And I said, "It's too late."
A bit late.
Yes. So that was, and I suppose that's because I don't have the staff to carry that out. It was just for them to come to my home
Yes.
while I could get out for a
Yeah.
moment without,
Absolutely.
yeah, without having to worry about
Absolutely.
rushing
Wouldn't it have
home.
been good to have Vicky and Lisa around at that time?
It would have been. It would have been. Yes.
You would have
Would
all
have
the
been.
help you need and,
would have
and
been very
advice that you
handy.
need to push you where you needed to go.
Yes.
Mm,
Yeah. It would
yeah.
have, if we knew now what we
Mm.
wish we knew then.
Yeah, and that's
Mm.
always
Yeah.
hard too when
Yeah.
you learn something after a fact and you're like, well, I wish I'd known that 6 years ago or
Yeah.
3 months ago
Yes.
or however
Yeah.
long.
I say this not being selfish, but more realistic in that people need to probably seek professional help more than they do,
Absolutely.
because it just ruins them.
Mm.
Absolutely. And professional help doesn't just have to be counsellors or family members. It could be your
Carers.
local doctor,
Carers.
other
Yeah.
carers.
Mm.
Yeah, and
Yeah.
confiding in your colleagues.
Mm.
Is that's another avenue you can take, but there's so many places you can phone out there now for help, like Lifeline, like Beyond Blue.
Yeah.
Yeah.
That's still going.
That's
Yeah.
flashing though, it's about to stop.
Okay.
Yeah, we caught it just in time. Thank you very much.
Yeah, because there'd be, I guess 85–90% of the population would never be near aware of some of the things you've just pointed out. They
No.
have no idea how to manage it, they have no idea how to address it, they have
Yeah.
no idea what to say and what not to say.
Well,
And it's hard
I-
to
yeah,
know
I had
these things.
no
without-
idea when Mum got it, and she come to live with me. You know, it was just, you know, in the dark about
Yeah.
everything, and just taking day by day. And I look back now and think, oh, you know, I should have been kinder and nicer and more accommodating and all those things. And I tried to do the best I could,
Yes, of
but
course.
there were just some things I just did not know. You know,
You
If
haven't
she
got the
said it,
tools, you haven't
yeah.
got the tools to manage
if
it.
she said something that wasn't right, I'd say, Mum, that's not right. No, but I found out you're supposed to just go along with
Yeah.
it, because then they forget.
Yeah,
So,
they'll
there was a
kind
lot of
forget
that
and move
to
past
begin
it.
with. Mm.
And that's a hard thing too, because there's not a lot of support groups out there for things like dementia.
No,
There's no,
no.
not a lot of like gatherings for those who have family members with dementia where they can share different ideas. This worked,
Yeah.
this didn't work.
Mm.
Yeah, and that does make it a bit.
You know, I've heard like a handful of stories from Lisa, who obviously runs the respite,
Yeah,
where carers, whether it's the wife or the mum or whatever, are just completely at their wits' end. Like there's been a couple recently that are on the brink of suicide because they just don't know what else to do.
don't know what to do. Absolutely.
And they can't, they're starting to get to that point themselves where they're, whether it's dementia or other things, and they're struggling to look after themselves, let alone somebody else.
It's a big ask of someone to
Yeah.
look after a family member who is on a decline.
And
Yeah.
respite in particular for them is just a saviour.
Absolutely, it's godsend.
Yep.
It really is a saviour, and if you can go down that avenue, by all means do it.
Mm.
Absolutely, because it could be the best thing that happens to your mental health.
Mm.
Like you said, they were
Just
on
that
the
one
brink
day
of
off.
suicide.
Yep.
1 day break could be enough to pull you back from that, so you can have a think to yourself, okay, I can breathe now, I've got a bit of space. No, that's not what I want to do, but it's certainly how I'm feeling. And that gives you a chance to reach out for yourself to get help too. Whether you need to see a counsellor or seek help from your doctor or whoever it is that you need to incorporate into your self-care.
I guess if you don't look after yourself, you can't look after
Well, that's
anybody
right.
else.
You can't look after someone else if you can't look after yourself.
No.
But that's another hard thing to realise too, because we're so used to looking after each other.
Yeah.
But when someone starts to go downhill and you find yourself more looking after them than looking after yourself, it's almost like a natural reaction. Yeah, so I just wanted to go over about what you've sort of learned today. Is there anything that particularly stuck with you?
No, just the different types of
Yeah.
dementia, I think. How many different types there are.
There's a
Yeah,
lot.
main thing
A
I've got.
lot of different types. Not a lot of people realise that there are so many different types of dementia and that they affect the brain in different ways.
It's not only just all the different types, but there's so many different things within those different types. Like,
Yeah,
Yeah, they're not all
Massive.
typical, are
No.
they?
No.
Yeah, very, very.
they're very, very, very
Yeah.
broad.
Yeah.
So the term dementia, like we said in the beginning, is an umbrella term, but there's so many things that go into that description. Yeah. Right. So everyone's done really well today. Thank you all for your feedback, and you've all done really, really well. And thank you for all the group discussions that we've had. So next training session, we're going to go more in depth to behaviours of concern and how to use distraction techniques to communication to help with those behaviours of concern so they don't escalate, which happens really, really quickly. Working in facilities mainly, I mean, I've been bitten, strangled, smacked, slapped, I've had poo thrown on me. It's not very nice, but it happens. So if you can kind of use distraction before it gets to that point, you'll be benefit yourself as well as your patient. So thank you everyone, and we'll see you next week.
So that'll
Go on.
be in 2 weeks' time, won't it?
In 2 weeks' time, yes.
2 weeks Sunday.
2 weeks Sunday.
Yep.
We'll go through that. Thank
Okay.
you very, very much everyone, and we'll see you next time.
Thank you.
Thanks.
And that'll be the last.